So I am sharing today here a 12-year-old patient who presented with 7 days history of high-grade fever, lethargy, vomiting, abdominal pain, loose motion and decreased oral intake before coming to us for the last 24 hours. Initially in pediatric emergency, this patient found to be dehydrated hypotensive, febrile with decreased urine output, and initial labs showed low hemoglobin with low platelets and deranged renal function and liver function, and initial dengue IgM came out to be positive after 72 hours. This patient was managed on the lines of dengue hemorrhagic shock, initial management with fluid resuscitation, antibiotics, kept NPO, proton pump inhibitors, and IV fluids were given with vitamin K. And this was the initial X-ray in the pediatric emergency, which is showing bilateral lower zone minimal fluids at the time of presentation. But later on in the course, this patient developed significant respiratory distress requiring oxygen, and then later on we have to step up to non-invasive mechanical ventilation with nasal CPAP. And these are the third and fourth day X-ray, which you can show. You can see there is a significant lung disease with bilateral ARDS and pleural effusion. So this patient managed on the lines of dengue hemorrhagic shock syndrome with respiratory distress, non-invasive ventilation. And at that time, when the lung was getting wet, we managed with restricted fluid, strict intake output charting, and given daily albumin for 3 days because albumin was also low with diuretics. And inotropes were started because even in spite of receiving fluids, this patient has low blood pressure. So epinephrine low dose with low dose milrinone was given to get the higher mean arterial pressure. And with the diuretics on top of albumin, this patient has a lot of urine output in the next 48 hours and kept in negative balance NPO. And later on, you can see there is a significant improvement in the X-ray, and patient weaned to nasal cannula and discharged after 7 days of management in pediatric ICU to home success.